that's a really good question, and particularly timely since my legislative session is coming up here pretty quickly. And I guess I could break it into three parts. The first part is, all the states are getting stimulus money. There's no reason why the labs, the public health labs, couldn't be part of that. Up until now, we're talking October 2009, and stimulus money's been flowing now for 9 months, I think. We haven't received anything. And there's probably two main areas that we could really get some help, because this money is time limited, so it's not to hire a person because they'll end up being fired when the money's gone. But we could really use this so-called one-time money for equipment. So I could use another extraction robot to really help my throughput with events like swine flu. I could use another instrument to help my throughput once I've extracted. I can do the testing. And I could also use it for information technology infrastructure. And in a perfect world, we would have an instrument, we would have a test result come out of it electronically, and we'd have an interface with some kind of computer system. It would take that electronic data, not somebody manually transcribing it on a piece of paper and then doing data entry. It would take that electronic data and it would turn it around to the person who ordered the test from me, whether that's a clinic or a doc in the box, as we say in my physician business. And it would save an amazing amount of manual labor, and my scientists doing things that making $25 an hour doing data entry work, which is a waste of their time. So I would say that the state could help us with ARRA funds, ERA funds, and steer some our way. These one-time monies would be very helpful. Secondarily, I need to work better with the state to just say, I'm here. It's that Horton hears a who sort of thing. And they could open up a dialogue with me that I've been trying to open up with them around this teachable moment. This is a teachable moment for everybody in public health and everybody outside of public health. And I would, if I could sit down with my legislators and just talk about the laboratory experience of what we experienced in May of 2009, I think they would come to better understand that. And then thirdly, the state, I think, you always have to talk about state monies. In my state, to give you an example, maybe I shouldn't talk about dollars, but I will anyway. In my microbiology bureau, it's about a $5 million bureau, and I get less than 5% of that money from state taxpayers. So I have almost no support from the state of Utah for microbiology. And now would be a good time to understand the import of what we do and to really say that we need a core amount of funding that is robust and sustainable. And it's not $5 million that I run and I get fee-for-service money and federal grant monies and private sector grant monies. It's an amount of money that will sustain us between what we just saw with swine flu. And 2003 we had SARS, and we had monkeypox in 2003, we had H7N7 influenza. These things don't happen every day. We need bridging money, so we need a sustained set of funding. And I would hope that the state is listening to what the public health world is trying to say. I hope that's helpful.
That's extremely helpful. Is there anything that you would like to add before we close today?
I would only add, I think, that APHL has clearly made my voice louder. They've magnified the voice of public health laboratories, at least regionally and across the country, a louder decibel level. And to the extent that I can get that to happen in my state, that's my challenge going forward.